good afternoon, good morning, good evening, wherever you may be in the world. Welcome to the webinar of the Geriatric Emergency Department Collaborative. My name is Don Mulady. I'm an emergency physician in Toronto, Canada, and I'll be your host for the afternoon. Thank you for making the time to be here. We know we've got a good audience, so we're way over 200 people registered for this, and we assume you're from all over the world, so welcome from wherever you're coming from. Today, I'm joined by three fantastic nursing emergency department nurse colleagues to specifically explore resources and possibilities for education of nurses working in a general emergency department, specifically around to improve care of older adults. We know there are a lot of resources in the vast world of nurse education. We decided that we wanted to put on a whole webinar to try and highlight a few high quality sources that we know of. And we've pulled together guests from three important institutions, the Nurses Improving Care for Health System Elders, the Emergency Nurses Association, and our own Geriatric Emergency Department Collaborative. We'll explore some of the resources that we have on our own website as we go along, and we're pleased to hear from our two collaborators. By the end of the next hour, I hope you'll be going back to your departments with a lot of new ideas or reinforcements of the ways that you can pass on education to your nurse colleagues in the emergency department. I do need to, as somebody outside the United States, I'll just point out that all three of our guests are from the United States, and we know that there are a lot of international participants here. Please, as we go along, if you have resources that you're using in your own countries, please make sure that they're shared. We have a diverse audience on these webinars from all over the world and from many parts of the healthcare system. So as of now, I just ask you to, we'd like to know who you are. So as we're getting started, please put, your name is already in the chat, but please put in what your job description is and where you're calling in from. And before you do that, just make sure that you toggle the little blue button to everyone, not just hosts and panelists. Next slide, please, Heather. So we, as I said, have over 200 registrants from 10 countries. When you registered, we asked you all this question: what's one thing you think every emergency department nurse needs to know about older patients? And next, we had lots of great answers. And Karen Mack, one of our guests, put together this word cloud, which gives you an idea of some of the many 200 answers that we got. You'll notice that delirium is prominently displayed, which gives an idea of how important it is. But I just love the range of things that are scattered around there. Caregivers, collateral, special needs, communication. Everywhere you look, there is a valuable part of providing care for older people. Next slide, please. I just went through all 200 responses and didn't record all of them, but these were some of the important recurring themes that came up. And as we're getting started, I'm just going to give you a few seconds here to just read through those things. I think each one of them is important. So I think it really speaks to the wide range of knowledge that anybody, nurse, physician, or anybody else working in an emergency department needs to know. And I think we would all acknowledge that what's on screen at the moment is a lot of stuff for any one person to master. And yet that is what we are asking of our nurse colleagues in the emergency department. So our guests today are going to help us find out how we can best support them to do that. Next slide, please. The Geriatric Emergency Department Collaborative, in case you're not aware, is a group of emergency departments around the world who are focused on providing high quality care to older patients. Our goal is to address the interdisciplinary best practices within geriatric emergency care, to disseminate those best practices and to help institutions implement them and then study the results. We hope for a world where every older person in an emergency department is getting the highest possible quality of care. If you're interested in knowing more about the GEDC, please scan the QR code there, and Heather will drop into the chat another link that you can access as well. Next slide, please. I'd like to introduce you now to our fantastic panelists, which we're delighted they're able to be here with us. Karen Mack is the executive director at the organization called Nurses Improving Care for Health System Elders. It's a major player in the nurse education world. Karen holds a doctorate in nursing practice and an MBA, and she has years of practice in the emergency department and in trauma care. LaToria Woods is a certified clinical nurse specialist with more than 20 years of working in the emergency department, where she continues to work. She's the nursing content specialist at the Emergency Nurses Association in their education division. And Aaron Malsch is one of my fellow core faculty at the GEDC, as well as being a clinical nurse specialist in geriatric care with seniors service at Advocate Aurora Health System, Aaron has been involved for years with improving that system's emergency department care for older people. That's the end of the slides. Thanks very much. So I'm just going to turn this over now to Karen and LaToria in particular. I'd like you to both let us and the world of audience on the webinar just tell us a little bit about your organizations and what you do. Karen, I'll go to you first.
Great, thanks, Don. So Nurses Improving Care for Health System Elders is a nursing innovation developed by Dr. Terry Fulmer, president of the John A. Hartford Foundation, over 40 years ago. Niche is a program, is now in its 4th decade formally. We pronounce it niche as if there's a T in it, because Dr. Terry Fulmer is always in the middle of everything we do. So we call it niche. There are approximately 350 niche member organizations in 4 countries, and we do additional work with other countries as well with our geriatric institutional assessment profile. The niche practice model includes implementation of 4 components: the geriatric resource nurse role, which is a nurse champion role; evidence-based geriatric nursing protocols for best practice that are all found in a textbook, now in its 6th edition, over 30 practice protocols for geriatric nursing. We also focus on transition of care processes and implementation of the acute care for elders unit-based principles and practices. Education is foundational to everything that we do here at Niche in terms of implementing the niche practice model.
Thanks, Karen. And LaToria, can you tell us about your organization?
Hello, everybody, and thank you for having me today, Don. The Emergency Nurses Association is a professional organization that's been around since 1970. That's when it was founded. And its focus is to represent emergency nursing professionals around the world. We provide education, We perform networking opportunities, advocacy, and we provide various resources to our members who include registered nurses, advanced practice nurses, particularly nurse practitioners and clinical nurse specialists that practice in the emergency care setting. And we also cater to other healthcare professionals. Many of our non-nurses take our geriatric education courses, which I find striking because my focus is emergency, and I was surprised to hear that other nursing specialties were benefiting from our courses. We also promote excellence in emergency nursing practice, and we want to ensure that quality patient care is always performed in the emergency care setting, in particular, not just for older adults, but all of the patients that present to the emergency department. Thank you.
So as I understand it, niche, which as I said in Canada is pronounced niche, but niche is really for nurses throughout the healthcare, throughout the hospital, whereas ENA would focus on nurses specifically in the emergency department. LaToria, could you just give an example of how you think it would, what resources does the ENA have that like another surgical nurse or intensive care unit nurse might find helpful?
Oh, sure. One of our biggest educational products that we sell is geriatric emergency nursing education, which we call GENE. Many of our medical surgical nurses take those courses because they manage older adult patients frequently, and also skilled nursing facility nurses take those courses to help them not only understand what we do in the emergency department, but most of the time they send their patients from there to the ED. So in case they get into compromising situations. So it's nice to have them know the process and the steps of what's involved.
And Karen, as I understand it, niche is a member-only organization. So an institution would become a member of niche. Is that correct?
That's correct, yes. And I see a number of our niche member organizations represented here in the chat today. So when an organization becomes a niche member, they have access to our online learning management system called the Niche Knowledge Center. And the Niche Knowledge Center has 35 or 55 modules, plus additional video series that are from our webinar series. The learning modules include our geriatric resource nurse course, focused on the role. Each of the modules within that course, though, can be utilized with their own contact hours. There's currently 17 of those modules for a total of over 14 contact hours. We also have Introduction to Gerontology learning path, critical care nursing of older adults, which many of our ED nurses utilize for their learning, as well as nursing of the older adults with cancer. And we also have a learning path for the non-licensed nursing associates, particularly ED technicians, CNAs as well. So we have lots of excellent resources. We provide our members with a sample learning plan, but we're not prescriptive around that. So the resources can be utilized in the way each ED feels their needs would be best met. We do encourage, though, for those organizations that are fully implementing a geriatric ED with geriatric nurse champions, we do recommend that those nurse champions who are often doing the focused assessments and detailed assessments of older adults complete the whole geriatric resource nurse learning path.
And just for, so I'm glad that many of your members are on the call. For those who are on the call who are not from niche institutions, what would be some arguments that they could make to their nursing leadership to become a member of niche?
Sure. So niche is one of only a handful of organizations that really focuses on education to practice, implementation, beginning with didactic education, and then working through protocols to implement evidence-based practices to care. And then our niche organizations also then utilize the didactic education, the protocols, and then they determine how best that care should flow in their organizations. And so when they do that, they typically create what we call job aids or tip sheets about how the practice should flow at the bedside. So we really believe in two levels of education: didactic education, but also implementation-focused education. Our niche organizations produce amazing outcomes. We're seeing organizations as they join, we have a focused 15-month leadership training program. And in that program, they implement a practice change project. We're seeing large reductions in falls on the units where they're implementing those, big reductions in pressure injuries. One organization, through implementation of pressure injury protocols and education, achieved $600,000 in cost savings. So we do see dramatic shifts in practice with implementation of education focused on protocols, evidence-based practice, and then focus in education on implementation practices, achieving great outcomes. So I would highly encourage, if anyone is interested, our nicheprogram.org has an area where you can inquire, and we'll be happy to follow up with you.
It's interesting, some of those comments kind of parallel a lot of the things we say in the GEDC around care, improving care of older people in the emergency department, is that the main reason to do it is because it's good for the patients. They're getting better care. And there's also a strong institutional value in things that are important, maybe to more important to your CEO or a senior management, of reduced costs, improved outcomes, decreased return visits, decreased admissions to costly, unnecessary admissions to the hospital. So it is mostly about good care, but it's not just about good care.
Exactly, and I'm sure LaToria sees this as well. In implementing these types of programs with the ENA and with niche, you see a focus on nursing professional practice and the work of nurses in organizations that really matter. It also helps restore, that joy of nursing practice to the nurses at the point of care, and creates a recognition of their importance in operations from day to day. And we also know the geriatric workforce pre-pandemic was woefully, there was a woeful shortfall of clinicians of all types in terms of geriatric nursing expertise. And so it creates a focus on geriatric practice as a career destination. And we often see nurses follow geriatric practice along the course of their careers into their doctoral work or their advanced practice roles. And so, yes, it highlights the work of nurses, and it also highlights the importance and the worthiness of geriatrics to professional practice over the span of a career.
LaToria, I'm just going to go back to you just before we go on to your kind of core content. I was struck as we were preparing for this webinar about how all you three nurse leaders were very adamant about the importance of education, yes, but also strategies for implementing that education, for not only learning best practices, but making sure that that you're working with a system that allows best practices. LaToria, can you think of any examples from your educational offerings that kind of support nurses to implement best practices?
Sure. I can speak to our emergency nursing residency program. It's fairly new. I believe it's going into its third year, but we all know that new graduate nurses are entering the workforce in large numbers, and they don't have the adequate training or the resources to have proper education to care for these complex patients. So ENA developed, we call it ENRP, but it's Emergency Nursing Residency Program. And one of our biggest buyers, I want to say, is Kaiser Permanente in California. They instituted across their whole system. So they believe that nursing education, specifically in the emergency department, is very important, much needed, and will give patients better care with less optimal outcomes.
Great. Okay, now, so we'll move on to some of the nitty gritty of your offerings for both of you. And I would just point out, as Aaron did in the chat, for all of you on the call, this is your opportunity to ask questions for 3 nursing education experts. Things that we might not otherwise get to, pop that into the chat. Things that might be on your mind, like how much does it cost to join niche, or how do I have to, what do I do to access the offerings that ENA has? Pop those things in the chat and we'll be sure to get to them. But I'm going to go to you next, LaToria. Again, can you just walk through what you think are the most important offerings that ENA has for nurse education?
Sure. So we have this, it's kind of like a academic type pilot. It's called ENAU. It's Emergency Nursing University, and it's our LMS platform, so our online platform where we offer different pathways based on where the nurse is in their career. So we have a novice pathway, which is designed for nurses that are new to the emergency care setting, not just new graduate nurses, but also experienced nurses who don't have any knowledge of emergency nursing. We also have the competent pathway, and that's designed for experienced ED nurses, like I said, who are interested in advancing their practice. The leadership pathway and the our newest one, the nursing professional development pathway, are for those that want to go into leadership and those that want to go into education. So we offer those 4 pathways, and within the first 2, the novice and the competent, is where we house our geriatric education based on level of nursing knowledge or the need for the geriatric education.
Can you give us a few examples of things that one might expect to learn in the novice or competent pathways?
Sure. So far we have 3 geriatric emergency nursing courses. We did title them level 1, level 2, level 3, but you do not have to take them in consecutive order in order to complete the courses. So we decided to, based on our membership feedback, to make the course titles more descriptive. So the first one is called Foundational Knowledge, and these titles will be changed based on the revision cycle. So within the Foundational Knowledge course, the learners learn about a systematic approach, how to perform a primary assessment, a secondary assessment in a systematic way, so it sticks with them. When they take care of an older adult, it immediately pops into their head. We call it the A through J mnemonic, and we also use that in our trauma nursing core course and our emergency nursing pediatric course. So we thought
these things would not be specific to the care of the older person, or are they?
We do incorporate older adult care in all of these courses, specifically geriatric emergency nursing education. That's strictly for older adult care.
Mm-hmm. Sorry, I didn't mean to interrupt you. Go on with the other ones that you're going to talk about.
And the next one is called high-risk patients. All of our education is case-based scenarios that help the nurse put themselves in the situation and try to figure out how to manage these patients if they were involved in their care in real life. So the high-risk patients course, the modules that are included in there are falls, mental health, abdominal pain, and cardiovascular. And these are, I know people like to say atypical presentations, but for older adults, atypical might not be atypical. It might be their norm. So we're trying to get out of that concept of them presenting with atypical symptoms. So that is the one that we focus on with high risk patients. The third one is called language barriers, and that is in a different kind of format. It's a conversational module. So you have this older adult that enters the emergency department, and every person they encounter who is involved in their care. In this specific case scenario, there's a language barrier involved, but we want to try to assist the nurse with how it feels to be empathetic in that patient's shoes to help them have better outcomes from their visit.
Do you think that would address some of the things that people identified at the beginning of our questions around communicating with people with dementia, for example?
Definitely. We do have a lot of scenarios where we have patients that are exhibiting cognitive disabilities and how you would communicate with them. So that's throughout all of our 3 modules.
Mm-hmm. Aaron, I noticed that you have some reports from the field that you actually, in your leadership role with Advocate, you've used some of these in nursing education. Can you tell us about that?
Yeah, actually, I think 8 of our sites are niche members, and we with ENA, with the residency program, with the trauma, there's a million different pieces. But I think what both of these organizations do well is one of the trends that has changed. Once upon a time, especially when I was much younger, in the ED, you would get experienced nurses coming to you to start. So, they know practice, they know how to work with patients and the overall piece. And that is having an experienced nurse and then starting them into the very unique environment that is the emergency department was a nice stepping stone. More recently, and very much more accelerated with COVID, nurses are brand new, fresh. They're learning practice and then the environment and then the specialty of geriatrics, the needs for geriatric or older adult patients. So the approaches from both the GRN, the residency program, and in the ENA's residency program and others really help them get on top of their practice, their environment, and then that specialty of the needs of older adults. So that approach has been very key for being able to meet our staff where they're at.
Good. So thanks, LaToria. You'll have some other contributions also, but over to you now, Karen. Can you just give us an idea of the main offerings that niche would have for emergency department nurses in particular?
Sure. So 2 things. One is we do have, as I said before, extensive library of online, high quality, asynchronous learning modules. In addition, in niche organizations, some organizations elect to take that content and either deliver it in a live class, so we have PowerPoints for our organizations so they can do that work, or they do it in a hybrid approach, and we even offer the opportunity to take post-tests online so we can provide them on nursing continuing professional development contact hours through the Niche Knowledge Center for live classes. In addition, we have our webinar series. The webinar series is free for anyone to attend. Only the niche member organization clinicians may receive the NCPD contact hours, but it's open for everyone. And so those webinars are really focused.
I just want to drill down on that. So
Sure.
Some of your offerings actually are available to non-niche members.
Our live webinars. And so those webinars consist of really 2 focus areas. One is national experts. For example, We had Dr. Therese DeLellis, who's a wonderful pharmacy colleague, PharmD, provide an update on the 2023 beers criteria. Dr. Donna Fick, who was the very first geriatric resource nurse, who's the endowed professor at Penn State College of Nursing and president of the American Geriatric Society. Her research is in delirium screening with the UB2, and she has given webinar on the UB2 in the last year or so. And so we have national experts, but we also have learned from our niche organizations. We have a focus particularly around those projects where we show how we educated, how we use the niche practice model, how the workflow looked. They often provide some of those tip sheets, those job aids for implementation. So we have a number of those webinars. I'll even mention we have one this week from the ED at Cedars-Sinai. Levon Haroyan and his colleagues are presenting on their approach to geriatric simulation to engage nurses in simulation education. So we have a tremendous amount of online modules available. We also have a curriculum guide for our members where we suggest learning platforms or learning programs. So we, for example, recently developed one that was about 10 contact hours that EDs could use maybe over a year, maybe over 2 years, realizing, workforce challenges are what they are. People's bandwidth, particularly for online modules, is variable these days. But we do also encourage, like I said, for organizations who want to utilize our content in live programs, that they have that option to do so as well. So I would say those are a number of the learning initiatives we have. We have a wide variety, though, from delirium to dementia to depression to mobility to feeding issues that older adults, so skin issues, falls, lots of different educational resources that our member organizations leverage with their EDs, particularly around where they see their clinical challenges or clinical opportunities.
So just wondering if you could imagine an average emergency department that made a decision that it wanted to improve nursing awareness of issues around older person care. Do you think, can you just think of how they might approach that using your resources? Would it be mostly like train up one expert and use a train the trainer model, or a hub and spoke model where one person's responsible for educating others? Or would it be some education for everybody? What do you think works best?
So every organization is a little different. So we often encourage people to know their own milieu and what works well for their organization. For EDs that are really very focused on standing up excellence in geriatric assessment and geriatric guideline implementation with a focus on geriatrics in their ED, we encourage those niche or those nurse coordinators or nurse champions for ED and geriatrics to do the full online GRN. Now, they could do that over 6 months, they could do it over a year, they could do it over 2 years, depending on what their bandwidth is. But we encourage them to utilize that. We also have excellent courses on comprehensive health history and comprehensive physical assessment that benefit that role tremendously. In addition, for the other nurses in the ED, they may choose to have them do work around, for example, delirium education as a focus for implementing a delirium guideline, or skin education. If they see opportunities, we have a skin module for opportunities around pressure injury prevention. So we encourage a focused approach for all nurses in the ED, and then for the champions to do a more comprehensive approach.
Good. And I guess I have the same question for you, LaToria. If you're thinking of the average emergency department, if we could imagine such a thing, what advice would you have for that nurse leader in that average emergency department who's made a commitment to improving nurse education around care of older people? How would they use your resources?
So I would direct them to start off with our geriatric education, of course, and then we also have other opportunities to learn about older adult care. We have a toolkit that specifically speaks to emergency department readiness. We have a number of practice resources, specifically one for falls assessment, falls risk assessment. We also have a topic brief for screening tools that are used to screen older adults' cognitive function in the emergency that you could use in the emergency department, because we know everything is time sensitive there. So we try to specifically speak to the ones that are conducive for that environment. And then we also have what we call clinical practice guidelines. So there's kind of like protocols to tell you, to guide you how to manage an older adult patient. We have one specifically on cognitive impairment for now.
Just before we move on from ENA's offerings, through my involvement with the Geriatric ED Accreditation Program, I notice a lot of places do use the GENE, G-E-N-E course. Could you just give us a brief account of that? I know you mentioned some of it, but what would that look like for a nurse in an emergency department taking that course?
So
that sort of thing.
It depends on where they are in their career path. So we do offer them separate if you want, but I think we went the way of the novice competent pathway. So we do have them housed there along with other courses to help, like a new nurse, new to the ED environment. And then as they progress, they can look at what we have in our competent pathway and say, oh, I want to take that next since I learned this, and I'm more evolved and experienced now. So it's like a step-by-step progression, and then eventually it ends in leadership or educator status. And I did fail to mention in our foundational course, we do have modules that speak to delirium, end of life care, and weakness, and things to that nature. So they're very detailed, and they do follow the 4 M's framework that the Hartford A Foundation uses.
Can you just expand? I hope everybody in the world knows what the 4 M's are. Could you just expand on that?
Yes, it's an approach that was developed, I believe, by the IHI and the Hartford Foundation. I know I'm chopping up the name, forgive me. But they developed this to help the healthcare professional understand what is important to the older adult when they enter the healthcare system. So one of them is what matters to the older adult. Like, they come there, they're ill, they're at their worst. What matters to them in that moment may not be what you think matters. Another one is surrounding medication. So we all know that older adults are on more than 10 to 15 medications. I know my mom is on 20 of them, and it's hard to navigate. So the medication portion of this framework allows the healthcare professional to get into the habit of figuring out what they're taking, how they interact with each other, and if they're causing some of the symptomology that's bringing them there in the first place. And then the other one is mobility, which I think to me is number one, right? Older adults, we tend to forget that they care about being mobile. If they're not mobile, then they think that, oh, the next step is going to be like a skilled nursing facility situation, or, bedridden. So they give up, they get depressed, and we want to get them active. So in our recent revision of our topic brief, we added mobility, which I was really happy about, to highlight how important that is. And last but not least is mentation. So how are they at baseline? Like, is this their normal? Because sometimes what might be um, like a significant thing for you to see, it might be normal for them. So learning how they are, where they are, and getting that information, you might not be able to get it from them, but you can get it from either a caregiver, a family member, or a close friend who cares for them.
Great, thanks, LaToria, for that at the bedside perspective on the 4Ms. And I noticed that our friend from Hartford Foundation, Jane Carmody, was all over it as well in the chat. So Aaron, I'm just going to turn it over to you because I think you had a question for both of our participants.
Yeah, this is, I think both Karen and LaToria started to touch on this. But how do you see nursing education? How has it been changing, and, change with your educational design, formats, length of, and, experience level? How your organizations, how have you been changing to meet the needs of our changing workforce?
So,
I guess Karen, go first. Yeah, sorry.
sorry, Aaron. So that's a great point. So one way we've done it is provide a curriculum guide to help people understand how to stage education, given the fact that organizations are, having different challenges and different readiness for education. I didn't share, but I was a frontline senior director of nursing excellence and resource management during the pandemic. LaToria, we were trialing your ED residency, and we're very excited to be doing that because I saw the exact problem Aaron talked about, right? Nurses right from school, right to the ED. But in terms of to be frank, I'm working on standing up a full instructional design group here so that we can adopt and adapt new best practices. The best practice that I hear from our sites is some sort of hybrid approach that has live education. It may be in a classroom. It may be just-in-time training, going around to different nurses. We have these, LaToria brought up a good point. We have a similar resource for the 4Ms framework. We also utilize the SPICES framework. We have pocket cards for these as well as the UB2. But we are adapting in terms of what nurses want. I am also a professional association member of a large association, and I know hour-long modules need to be rethought. So we have a number of those. We'll be rethinking those, repackaging those, readjusting, encouraging people to try innovative approaches, which is why we're featuring ED simulations. We also encourage something we call age sensitivity trainings that are very interactive, that help put people in the shoes of the older adult. One of our partners, UPMC, has a great one, but most of our niche organizations implement something not only for nurses, but for everybody, so that they understand, what is it like to have a visual impairment? What is it like to have mobility issues? What is it like to suffer a series of losses, right? Loss of your driver's license, loss of your dog if you have to move from your house. So we encourage also these interactive sessions that our niche member organizations are so adept at developing and implementing within their organizations. And then we share those best practices throughout the niche organizations. But yes, we are looking to adapt to an ever-changing workforce's desires around ongoing education and professional development.
Excellent. I'll just make a comment before letting LaToria. The experience of that empathy training that is the most powerful piece to be able to have staff like that are 25 years old, and how does it the world is fresh and, you know, because they haven't experienced these things. Having that empathy training has been one of the most powerful motivators that I've ever seen. So I just hit that work is spectacular. I'm sorry, LaToria, I'll let you respond to how Gene and other education has changed over time.
Okay, so I'm glad you asked, Aaron. It has changed a lot. ENA has an incredible digital learning design team, and they stay up to snuff on what's out there, what's currently happening in the world of education, and how it's being delivered specifically to adult learners. So we have gone away, and we hear our members. They tell us what they don't like about the courses and what they like. And we used to have in text boxes where you typed in responses to knowledge checks. One of the things we veered away from was that. So now we utilize a lot of interactivity like drag and drop, click to know more, move from here to here to get the answer. So they really love that. And we also use AI. I know that's scary for some people, but using human voices sometimes doesn't work out as well as we'd like, and it was a lot of back and forth, but AI has helped us tremendously. Um, the voices previously were robotic. I'm sure you remember from the first inaugural Gene course that had 15 to 17 modules. That was a lot to take in, but we also listen that they want them shorter so they can do them when they're on their break, if they get a break on the unit, or they can have a shorter time to complete the work. So we've gone away from having longer modules to bite-sized education, and they love it. They're taking to it very well. So we listen.
I'm just going to lob in a couple things. For one, thanks for bringing up the issue of simulation, and I did post in the chat there a resource that's on the GEDC website about immersive simulation. That's something that I've developed here for our residents, but also has been rolled out several hospitals for nursing education, where we have an aging suit that reproduces many of the physical limitations of being an older person, which we get residents and nurses to wear, and then put them through their paces as an older person in the emergency department, getting changed, getting up onto a bed, going to the bathroom, listening, hearing, seeing, filling out forms, to give them a real life sense of what the older person's experience in the emergency department is. And then we can have a reflective exercise after the fact. And I'm pleased that you both mentioned kind of some innovations in online learning of the drag and drop, the click to learn more, the simulated stuff. I am going to mention right here, we're going to do it later, but on the GEDC website is geriem.com, which has 8 modules, all accredited for nursing education, for 8 contact hours. Which use all of those techniques, including simulated patient, videoed patient encounters. And I notice our very knowledgeable and experienced friend, Joan Michelle Mosia, mentions all 3 of these as the main routes towards nursing education for accreditation: ENA, Genie course, niche, and then geriem.com. Yes. So I just to another question for both of our nurse leaders. What would you say are the biggest challenges? And just choose 1 or 2, but also challenges, and how do you address those challenges with improving nurse education? And I'll start with Karen. Challenges and how to overcome them.
So the workforce has changed. We all know that. The workforce has changed in this sense that nurses are more mobile. They may be at one organization for a year or 2. They may be temporary staff. They may be brand new to practice. as we discussed, working in the ED. The workforce has also changed in the sense that they need work-life balance. They need just-in-time training. They need things that work for them cognitively in a world that is ever more stressful. One of the roles I haven't highlighted yet, which is, and I know a number of you who hold this role are on this webinar today, is their niche coordinator role. And so the niche coordinator is a nurse leader or nurse specialist who is frontline, who understands the care environment, and then works with the GRNs, often holds a specialty certification, such as a clinical nurse specialist position or certification that Erin, LaToria, and I all hold, or a nurse practitioner, but also may be a nursing director for a geriatric unit or an ED. And so they work closely with the nurses in implementing the protocols, in working on implementation of the education, either modules or live, using those pocket cards. And also they engage their nursing continuing professional development specialists, if they themselves are not in that role, with this work. And so I think that for us is really the piece that makes the work meaningful and makes the work achievable. Having nurse leaders, particularly in specialists, who go to the bedside, who look at the practice issues, who know the evidence-based practices, and then have a portfolio of resources and education they can bring to the team in ways that make sense to the team, is very important. I would mention we do have a 15-month online leadership training program, as well as a niche coordinator boot camp for organizations that have a new niche coordinator but have a very robust program. But the leadership training program is for new organizations to niche. We require that for new organizations, and also for organizations with a big strategic goal, such as implementing a geriatric ED, because they'll have focused time to work on those implementation projects and develop in those roles. But that niche coordinator is the hub of the niche work, and that connection between evidence and practice and the direct care clinicians and other disciplines as well.
Thanks for that, Karen. And it partially addresses a question that showed up earlier from Kevin Bice, who's actually on the screen, since he's core faculty with the GEDC and in fact the lead. Kevin, you could launch it yourself, and I think in part Karen and LaToria have answered the question, but go ahead.
It's wonderful. It's incredibly important. So I'm Kevin. I've met y'all, most of you before, but I'm one of the GEDC core faculty and the principal investigator for it, and I also chair the Geriatric ED Accreditation Board. Incredibly important topic. In fact, I was just talking this past week in DC at a congressional advisory committee about GED work, and mentioned that the nurse leadership is the most important component of the GED, in my opinion. I like doctors, I happen to be one, but the nurse leader transforms the culture and can drive forward change in a way that I don't think any individual physician can. So this is just an incredibly important topic. I think we're talking, we are talking about a number of wonderful interventions, and I guess I mostly just want to open the door, not necessarily, I'd love additional thoughts now, but open the door to continue to think about how to interdigitate these programs. When we created the GEDC website a few years back, we wanted it to be one-stop shopping for people to come to. Hey, I want to make my ER better for older adults. I wonder how I do that, right? And it's hard to go to lots of places to find that information. Now, that doesn't mean it all has to be from us, right? So how do we have the right links on our website? How do we point people in the right direction? We're already doing a lot of that. I know Heather's leading a lot of that work, but I just want to open the door to that, because the same because as accreditation has grown and as awareness of the need for improved emergency care for older adults has grown, whole departments are going forward. It's not just individuals saying, I want to learn more. It's the department, as you both know so well. And so I want to make sure that we do everything we can to make sure that we're cross-linked, that we're connected, that we create curriculums for people that really drive forward that and make it sort of easy to interdigitate all these great offerings to build up programs. So I'd love any additional comments on that. I know a lot of it has been addressed already, and mostly this is an open door, just like, so if there's any wish list that you want from GEDC or GEDA, now would be a good time to say it. And if not, would love to hear it later.
And just before I turn it over to LaToria to answer that, I just need to draw our attention to Sue Harvey's comment, pointing out the importance of programs that start at the bedside with nurses and doctors and work up, rather than programs that are commanded from above by senior management. And I think that's really what this webinar is trying to promote. So LaToria, over to you about any of these comments.
So Kevin, let me see if I understand. You want to see all three groups come together with?
I want to make sure that GEDC is doing everything we can to make ENA and Nietzsche's great courses available to anyone who's interested in improving emergency care for older adults. So any asks on the front of how we can do an even better job of that driving forward.
So I think that you guys already promote our links. You provide our links to our geriatric education. And we do the same thing for you as well. We mention you guys in our topic briefs, our geriatric toolkits. So we get the awareness of your organization out there. I'm not sure that we do too much with niche. We used to, but I don't know why it fell away from incorporating that. We may mention the organization here and there, but I don't know if we do enough to put it out there.
And so, this today's webinar will be a good launching pad to start doing that again.
Yeah.
So sadly, we are coming to the very top of the hour and to the end of this webinar. So I might just ask Heather if we could go back into the slides for a moment, just to do, starting from, yes. So as you probably know, all of these resources will be up on the GEDC website as of probably tomorrow, depending how hard Heather works tonight. And that will be a recording of the webinar that you can share with any colleagues who missed it. All the slides, including these valuable takeaway points from Karen and from LaToria. Next slide, please, Heather. As well as the chat, as well as all of the resources that have come up, links to all the resources that have come up during the webinar. Next. We don't quite have time to get back to this, but I think if these are all the things that an emerge nurse needs to know, we've got that person covered. There's lots of resources out there. Next slide. On the GEDC website, Aaron, actually, you might want to just introduce, comment briefly on these resources.
Yeah, so as I wear multiple hats, so I get to not only help with these, but also use them. The wonderful thing about nursing is it's a very broad category. Charge nurse, triage, geri-ED, champion, our gene nurses, our GEM, or highly specialized ones. Each one of those has a different need. And so how we use like the niche, the niche, the ENA, and then also our GEDC materials as well. So some of the things with that in mind, some of the things I start out with, like for my brand new fresh nurses, like staff nurses, that the GERI-EM module, especially the atypical presentations and transitions of care, that's a great opening. But then there's also higher level pieces. So you'd see on that right-hand side, skills fair. These are great resources that really focus in and expand upon a clinical topic area, so a much higher level. And so these are great examples, and there's also toolkits available as well, but a nice way to be able to tailor it to the specific need of the nurse that you have.
Thanks, Aaron. Next slide, please, Heather. and this has come up multiple times. Everybody likes something that's free. So this is free open access nurse education. There's 8 hours of accredited learning here covering all the topics. And they're all available for you on the GEDC website. Next slide. These are 2 things that have been valuable for nurses around dementia and delirium in the emergency department on the AARP website, which GEDC helped develop. Next slide. Those are all the resources which have already appeared in the chat. Next. And next slide, please. As we're wrapping up this webinar, it's time to start planning for the next one. Please come back in the hot days of mid-July. We'll be talking about the elder mistreatment for the ED toolkit to learn how what it is and how you can implement it in your place. Next slide. And we've already talked about GEDC plenty. And final slide, please. We can't do this without our wonderful collaborators and supporters. Thanks to the John A. Hartford Foundation, to West Health Institute, who provide us with the support we need to do this work. And a special thank you to our expert panelists today, Karen Mack, LaToria Woods, and Aaron Malsch. Thank you for being with us for the last hour, and we'll look forward to having you again in the future.